So we've learned about the liver. We've learned about its gross structures, its microscopic structures. Now let's learn about the histology, look at some slides, and talk about liver pathologies. So first of all, when we look at a microscope slide of liver tissue, what we see is this really clear lobule here. And you can see all of these little channels focusing on this central thing. So obviously these are the hepatic sinusoids. This is the central vein, okay? And then we can see a couple portal triads in this section. And this is zoomed in on a portal triad. So we can see that the branch of the hepatic portal vein is the largest part of the portal triad. The hepatic artery branch is much, much smaller. Now remember, this one is bringing, the hepatic portal vein is bringing all of the blood from the whole digestive system. So it's a lot more blood than is being carried through the hepatic artery. Remember, the hepatic artery proper branched off of the common hepatic artery, which was one of the branches off of the celiac trunk. So this is carrying much less blood, much smaller, but you can see it's got a nice thick wall like an artery should. Then over here we have a bile ductule, which you can see has a simple cuboidal epithelium around it. So that's obviously a duct and not an artery or vein. Okay, so when we look closely at these, we can distinguish which is which. And again, here's the lobule, okay, all the way around. Yeah, it doesn't quite look hexagonal. Part of that is the way that the tissue shifted as the section was made. And then you can see all of these sinusoids bringing the blood from the corners, the triads, to the central vein. And then, of course, all of these little dots are hepatocytes and the cells that make up the walls of the sinusoids and the bile canaliculi. Now, things that can go wrong with the liver. Normal healthy liver tissue should look like this. Really clear hepatocytes all next to each other with little channels in between them. One common thing that happens is fatty liver disease, where the liver starts to store too much fat. And then remember that adipocytes are actually pretty big cells. They're actually much larger than the hepatocytes. So you get this buildup of adipocytes within the liver, and they crowd out the hepatocytes and inhibit the ability of the hepatocytes to do their job. So if fatty liver disease gets very bad, you're going to end up with less liver function. Now, fatty liver disease can lead to an immune response that can cause scarring, and that can cause cirrhosis. So in a cirrhotic liver, I'll show you another better slide in a moment, we actually see scar tissue building up, which of course does very clearly inhibit the function of the liver. So again, here's a normal healthy liver. Here's a portal triad, of course. Yeah, you can see that. And you can see all of these little channels and the hepatocytes nicely packed together. And around the hepatocytes, right up against all of the sinusoids and canaliculi. But over here, now this is a little higher magnification, but we see these fat cells, these adipocytes, crowding out the hepatocytes and limiting the number of sinusoids, the ability of the hepatocytes to get next to the sinusoids. So that's a clear sign of fatty liver disease. Now, cirrhosis of the liver, again, is scarring, and this is what a cirrhotic liver would look like. A healthy liver is very smooth, and it's a darker color. Now, cirrhosis of the liver doesn't only develop from fatty liver disease. In fact, for a long time, people thought it only developed from abuse of alcohol. And it takes decades of chronic abuse of alcohol to develop cirrhosis of the liver. Your liver can take a lot of abuse before it starts breaking down. It turns out that concentrations of fat in the liver can also develop into cirrhosis. So when we look at a cirrhotic liver here, we see hepatocytes around those little channels like we expect. And then we see bands of connective tissue. This is actually scar tissue that has built up in response to an immune response in response to the hepatocytes being damaged and inflamed by the presence of a lot of fat or alcohol. This is a colored image where you can see scar tissue, like here, and adipocytes as well. Okay? All right, so that's the end of that short little thing about what can go wrong with your liver. So do take care of your liver. Don't drink too much. Don't eat too much fat. Remember to drink plenty of water.